is only about a year old, and the person who's in charge of occupational health there is Dr. Bertram Carno, who is known fairly widely in this area particularly, and is involved in many areas of occupational and environmental medicine. In addition, as I say, we're starting and we're just beginning our program in occupational health. We had the first group of Masters in Public Health students started last September, and we will be taking industrial hygiene and occupational health students this fall. But if we can help in any way, certainly if it doesn't require too much money, we can do it. So that's our only problem. But we'll certainly have people who are interested, and the facilities, as far as we have them, are open to you. Now, I'm not sure whether or not the order in which I give information is necessarily the most, or indicates its importance, but there are a few things that concern me greatly in occupational health, and in addition to those things, like you see posted on the wall, the noise problem, the lung problem, there are some general broad areas that I feel that need to be stressed from time to time in evaluating occupational health problems. One is that in terms of either injury or disability to a worker, to me it's important to look at the effect of that injury or disability on his total being or his total quality of life, and not just to his work output. In many cases, I think in the evaluation procedure, the effect on his work output is considered only, and not what effect it has upon his capability of living in community or his family life. So in some way, I think we need to address this, and I know Dr. Carno is very interested in trying to get into this area of defining some measure of quality of life, and looking at the effect of a work disability and the whole question of rehabilitation. Another one is, again, I'm concerned today more in terms of occupational health and less in terms of safety, in terms of injuries. I think many of these have been discussed already. There are some other general questions that I'd like to talk about in terms of health evaluation, and then I have a set of slides I think that will summarize some of these. One is the whole question of the dose versus time of exposure. And any of the questions that we look at, whether it's noise exposure, dust exposure, any of these problems, whether it's an exposure to a chemical, the amount that you're exposed to and the length of the exposure time are important questions. And if we take the lowest toxicity material, even air, if we have too much of it over a long enough period of time, then it can cause problems. Many of you are probably familiar with hyperventilation, just by breathing over and over so rapidly that really the loss in carbon dioxide can cause a problem. Now, if we go on the other extreme, the high toxicity materials, one of the most toxic, whether it be carbon tetrachloride or whatever the material, if supposedly, again, these are the assumptions that have been made, that if the dose is low enough and if the exposure time is short enough, we can be exposed to this material. And that, by and large, is the basis upon which many of these TLVs are based, that there is some level at which you can be exposed and suffer, quote, no harmful effect. Now, the thing here that is defined is no harmful effect. We have to first try to find, is there some effect that that level of material causes that's acceptable or reversible? Examples of these, a recent example I think that is becoming more known is the problem of asbestos. In determining the permissible TLV exposure to asbestos, for instance, the basis of it was the production of asbestosis, or a lung condition resulting from this exposure. Well, it's now felt, and it's been stated by Dr. Wagner from NIOSH, that there may be no threshold even to some effect due to due to the exposure of asbestos. We might not get asbestosis, but you may get a cancer produced as a result of only one fiber if given long enough latent period. So not only is it important to determine the dose, but you have to also make sure that the effect that you're looking at that we choose the most sensitive indicator possible to measure the effect of that particular agent. Asbestosis in that case is not the most sensitive indicator. I'm not sure that mesothelioma will be that easy to detect, but this type of cancer, which is produced in the lung by a fiber, may occur with much lower doses. Now, the other point that I'd like to mention is the threshold versus non-threshold phenomenon, and particularly in radiation, I think it's becoming increasingly acceptable that any amount of radiation insult will cause some effect on the person exposed, no matter how low the dose, so that it becomes not a definition of there being no effect, but what effect will you be willing to accept. So these are some points that, to me, need re-emphasizing over and over again. There are many times that in the TLV book, and I'm not criticizing the TLV book in the way that it might be, there are many criticisms that can be made of the data that are given in here, and the people who started giving the information would be the first ones to admit it. But by and large, each of these values are based upon the exposure of only one of these materials at a time. So the other problem that hasn't been addressed very much is the problem of synergism when you're exposed to more than one agent in your work day. And obviously most of the time you're not exposed only to heat stress. You're exposed to heat stress maybe in conjunction with carbon monoxide exposure or beta-naphthylamine in the coke oven workers, this sort of thing. So the whole problem of synergism is being looked into more, I know, by many of the NIOSH projects. They're looking at some of these problems. Another important point is the high-risk population. Are there people who are much more susceptible to this to problems? Things like smokers. In many cases, inhalation of materials that will cause lung problems result in more damage to a person who smokes cigarettes. And in many cases, the smoking of cigarettes completely masks any other effect that you look at. So smoking is one thing. Heart disease, age, sex, and all of the other things that may need to be considered. Okay, so those are some of the things I think that need to be stressed over and over again when we're talking about the effects of either physical, biological, or chemical agents on a person. I have a lot of numbers. I don't think that I'm going to